I'd like to introduce you to the potato. The best thing to do is to get a regular potato and microwave it so it's extremely soft and the skin is quite fireable. For the exercise, it's important to cut it in half and put it in the bottom of a basin to represent an organ sitting within a body cavity. This is to simulate the necessary and reinforce the necessary angles to enable you to practice. For the purposes of the camera, we'll keep it out of a pudding basin, but I hope to demonstrate the importance of the angles as we go through. The potato, being hemispherical, enables you to practice your stitching on the top, the front, the back, and the sides, and therefore get you to practice your posture, your dress, to ensure that your needle is at 90 degrees to each of those surfaces. Let us see. It is very easy on the top of the potato to rotate the needle in and out. I am deliberate in introducing the needle at 90 degrees, rotating it through gently, and pronation, supination, and deliberately delivering the needle out on the angle. As I previously said, imagine a diver going into a pool. If you fail to go in at 90 degrees, or you rip the needle out, you'll find that the potato will tear and you're left with a plume of white potato, a bit like the diver hitting the pool at the wrong angle. Your challenge now is to practice rotation of this needle in every aspect of the potato. And in doing so, work out for yourself the best body position to be in to ensure that your needle at all times is rotating through this potato cleanly and not tearing it. It's an extremely useful exercise because the aorta and the pulmonary artery are likewise very unforgiving. I remember a trainee practicing closure of an aortotomy in the wet lab, and I was not very happy with the final result, as he had skidded the needle through the tissues and out the tissues. Within 2 weeks of practice on a potato, in his own time, on an ironing board at home, he had mastered the rotation of the needle and was so effective that at the next aortic valve replacement in theatre, I got him to close the aorta. The irony is that his half of the aortotomy did not bleed at all, whereas my half of the aortotomy had a few sweat holes indicating that I was not as clean as rotating the needle through the tissue as he was. And this potato reinforced his needle handling, his angles, and enabled him to practice the rotation, whether it be forehand and now backhand. Note, the tissue is actually holding the needle, the potato is holding the needle, enabling you to pick it up again and use it. Now, one of the most difficult stitches is closure of an aortotomy. So imagine that down here is between the aorta and the atrium and is the lateral extent of your aortotomy on the patient's right hand side. It's called the angle of sorrow. It's also deep. To effect a good rotation at this angle, I'd recommend that your needle on this occasion is at 90 degrees to your needle holder, that you use the principles of putting a flat back cupboard together. In other words, using your shoulder to elevate your elbow, get that in the air, enable you to effect a backhand rotation through the tissue at 90 degrees at the angle of sorrow. It is an awkward angle and one that you cannot quite appreciate until you have practiced on the potato. I hope you have fun.